be part of this great team. I will introduce Dr. Hendon that will discuss the pediatric surgery. Thank you.
Thank you, Benjamin. And when Vig asked me to speak, he told me I only had 2 minutes. And those of you that know me know I'm fairly passionate about this, and I'll try to get this done. It's one of the main reasons I came to VCU was the opportunity to implement this vision of children's surgery. And the vision is to consolidate all the pediatric specialists within all the other departments under one roof. And this would increase pediatric competencies. And we have functioned under the auspices of a virtual Department of Children's Surgery now for about 2 years. We have a number of graded treatments that are highlighted, some of these on the slide, and I'll just mention some of them as well. About 2 years ago, back up one slide, please. 2 years ago, we developed a children's OR block, which in essence is a virtual children's OR within the main OR environment. The idea there was to increase pediatric anesthesia for our pediatric patients. And over the last 4 years, we've gone from 54% of patients under 15 that receive a pediatric anesthesiologist. Now it's over 90%. So great achievement there. The other thing we did was centralize all the scheduling for the children's surgeons. And again, that's orthopedics, ENT, urology, surgery, plastic. And we did this with great effort to increase utilization. We now have 2 operating rooms functioning at the Chor Pavilion with great utilization as well. And then the last was our growth strategies. And this slide here depicts our growth count. And if you look at the dark blue, you can see the increase in number of cases that we've had at the Chor Pavilion. This is double-digit growth year on end for the last 4 years. With COVID, we ticked right below double-digit. We're at 8% over the last year. And then the last crowning achievement was the application for certification of the ACS Level 1 certification, which we're in the final stages there. All this could not be done without help. My partner in crime, Dave Lanning, has done a lion's share of the work, as well as Will Zolzer and Susan Torty and Kira Hawk, who is our associate administrator for this. Next slide. Within children's surgery, we have a number of premier programs, and all of these are an interdisciplinary approach and collaboration. None of these could stand alone on its own, and all of these are stepping stones for our goal to be a top 20 hospital within the year 2022. Just to highlight a few, and there are more than these, within the general surgery, oncology realm, we have a solid tumor program run with Dr. Laura Boomer. Within neurosurgery, in collaboration with neurology, we have surgical treatment of epilepsy with Dr. Gary Tai. Within orthopedics and anesthesia, they're combining their services with the ERAS principles and enhanced recovery after surgery, led by Dr. Tori Kuster. Our cleft lip and palate program in collaboration with ENT with Dr. Jen Rhodes. And then finally, a collaboration with our maternal fetal doctors, pediatric nephrology and urology with our prenatal hydronephrosis registry, which is the only registry in the country, as well as our robotics program led by Dr. Rebecca Z. We have a number of achievements with our 4 badges in U.S. News and World Report. I mention all 4 because none of these can be done in isolation. Urology would not be ranked without nephrology, for example. Pulmonary, the same with lung surgery, and cancer is integrated into our general surgery and urology programs as well. So we have a lot of achievements. I think the future is bright. We have an expansive growth strategy within the region. And I'm not speaking to Richmond, it's more of the Commonwealth and the Mid-Atlantic. Our goal is to be a top quaternary hospital in the Mid-Atlantic that attracts the best talent for children's surgery. And at this point, I'll turn things over to one of our esteemed leaders. Charles doesn't need an introduction. He's a great surgeon. Not too long ago, he was awarded for his great educational skills as well. And then Charles, I'll let you go ahead and take that away.
Thank you, Tony. And good morning, colleagues. Serving as the sole provider for pediatric surgical services in both the greater Richmond and all of Central Virginia, provides for us both unique challenges and opportunities. Under VIG's leadership, we're making plans to move ahead in the future. As you'll see on the next slide, this one shows our nurse practitioner, Nancy Thompson, doing what she does so well. And most of you know Nancy, I'm sure. What we're looking for, you can see the slide, and in interest of time, I'll just move ahead, that we're moving ahead to develop new and interesting, innovative centers of excellence. You've heard already about our pediatric cancer programs, but we're developing new programs and centers in colorectal surgery for complicated anomalies under Doctors Odesika and Sulkowski, to expand our bariatric and minimally invasive services under Dr. Lanning and Odesika as well. And with Dr. Sulkowski and hopefully new recruits, we look to expand our interest in ethics into perhaps a regional bioethics center, including biomedical ethical research. Our surgical education programs under Dr. Lang and her interest in surgical education in the SIM Center are enhanced and an enormous part of our overall program in surgical education. And our programs now existing in neonatology and critical care and the field of trauma under the expert management of Dr. Haynes will be enhanced as well, hopefully under new faculty recruits. VIG asked for some sort of a gripping case. So the slides you see interspersed here, there are only a few of them. I think they illustrate several things that are unique to pediatric surgery, including the somewhat bizarre nature of many cases that come our way, but also the need for these wide-ranging interaction and involvement with multiple specialties. The X-ray you don't see is a toddler who presented to an outside hospital with what looks like a metallic bracelet in the abdomen that showed up on a routine chest X-ray. We received a call from an outlying group, in surprise what this might be. And that led to a series of studies and upper GI barium enema studies that were suggestive, but far from conclusive for what looked like a very, very strange anomaly. And that led to the child having an upper GI endoscopy and then a laparotomy for what turned out, as you see there in the picture in the center, to be a series of ingested magnets, completely unknown to the family, of course, that had eroded the duodenum and the hepatic flexure and formed a ring between the two of those, oddly enough. Those were removed through the opening you see, and the removed magnet shown outside reconstituted itself on the plastic specimen container in front of our eyes. The child had an uneventful, thankfully, an uneventful recovery. And I showed this case to illustrate several things that I think are really, really important and foundational. And that is the incredibly talented and committed groups of colleagues that I work with in pediatric surgery, as well as many of you as well, and the relationships that are so key to our work, both at CHOR as our foundation and elsewhere too. As we move into the Children's Hospital in the near future, that will clearly require new adjustments, new planning, and it will certainly require some adaptability. I thank you, Vig, for your longstanding support, Elias, and many others in helping us to bring this about. It's a time of enormous promise and great challenge. We look forward to it enthusiastically. And now I'll turn you over to Jamie Bowles, the head of colorectal surgery. Take it, Jamie.
Thank you, Dr. Bagwell. In colon and rectal surgery, our clinical strength is to provide multidisciplinary care for complex colorectal conditions. Internally, we've established multidisciplinary programs with various collaborations with our colleagues to make sure that we can provide this care. Clinically, we're becoming recognized as a division that provides care for complex colorectal disease. And our clinical goals are to continue to exceed our quality benchmarks as we have done for the last 3 years of our infant existence, and to continue to strengthen regional referral relationships for continued growth. Can you advance? In the education and research realm, well, in our clinical realm, we've recruited Dr. Stephen Sharp from the Cleveland Clinic, Florida. He's recently joined our team in the last month. In our education realm, our goal is to apply for a fellowship within the next year or two. And Dr. Wiegard has been named Associate Program Director for General Surgery Residency. To grow our research program, Dr. Reve has received her first but not last extramural funding. And Dr. Khalil Bitar has joined the colon and rectal division as a research affiliate. He is a smooth muscle expert who he and I collaborated at Wake Forest, but has now come to join us here. Dr. Kajarajan asked me to speak briefly about the biosphincter, which is a reinvigorated project that we've been working on for some time. This is an autologous internal anal sphincter grown from the patient's intestinal stem cells and then reimplanted to treat fecal incontinence. Dr. Bitar and I completed animal proof of concept studies in rabbits and non-human primates that demonstrate this is a dynamic implant that survives over time. We have to complete some biocompatibility studies, and after that, hope that our IND application to the FDA will be approved so that in the next year or two, we can start our human safety trial here at VCU. Next, I'd like to introduce Dr. Feldman in plastics.
Thank you very much. Good morning, everyone. The Division of Plastic and Reconstructive Surgery is dedicated to service, research, and education. This includes a comprehensive breast health program bolstered by superb microsurgeons dedicated to the art and science of breast reconstruction. We are paving the way for women's health through state-of-the-art techniques, research, and education. We have the only nationally verified burn center in the Commonwealth, which is partnered with both industry and the Department of Defense to bring tissue regeneration research from the benchtop to the patient. This is the only program for burn education across the Commonwealth. We also have the premier center for craniofacial surgery approved by the American Cleft Palate and Craniofacial Association. This is a team of over 15 specialties. They all work together to provide exceptional care for our children. Our division also provides life-changing, state-of-the-art scar management, cosmetic surgery, hand surgery, complex wound reconstruction, and gender affirmation surgery. Together, we can go beyond to fulfill our mission of preserving and restoring health for all people of Virginia.
The burn team here at VCU has been absolutely incredible. My burns have been treated beautifully, and I'm very confident that they will be that they will look like the rest of my skin in the future, which is incredibly important to me.
We have priorities. We are prioritizing patient access, program expansion. We want to exceed our quality benchmarks, are looking to expand research and establish a collaborative burn and critical care fellowship in the future. I appreciate this opportunity to talk to you. I'd like to introduce Dr. Jose Trevino, the Division Chair of Surgical Oncology and the Massey Cancer Center Surgeon-in-Chief. Thank you.
Thank you very much, Dr. Feldman, for the introduction. I think there's two words for the Division of Surgical Oncology. I think it's expansion and obvious growth within our program. We have an incredible program in breast, endocrine, HIPEC, which is an incredibly specialized surgical specialty in surgical oncology, melanoma, as well as pancreas and gastrointestinal cancers, all of which is the foundation of the incredible group that's here, including Dr. Grover, Dr. Fan, Dr. Baer, Dr. Fernandez-McGuire, Dr. Louie, and Dr. Kaplan, all of which worked great to try to continue this incredible program and also build for the future. While our visits and our OR cases have remained stable, I think our strategic focus has been quite expansive in the terms of our expansion into Fredericksburg, Williamsburg, Tappahannock, as well as West End, and also the initiation of what I hope to be an incredible outreach program to really reach out to our communities to bring in more patients to VCU to provide excellent care. From a research perspective, we're going to continue to participate in the Massey Cancer Center. And all of this is pretty much related. As we start to bring more patients in, we allow more patients to begin part of clinical trials, which I think is incredibly important. We will start expanding our multi-D programs, as mentioned, the programs above, as well as collaborations with the Massey Cancer Center and other oncology divisions. One of my focuses and one of my passions is cancer health disparities research that has a basic and translational component. And I think with the Massey Cancer Mission, that's really going to allow us to do is, as I mentioned, bring in a great deal of revenue as well as NCI, NIH funding, and again, reach out to the people of this population. We have an incredibly diverse population in Richmond, which is what attracted me to come here and really hope to build that part of our research endeavors. Next slide, please. Our recent accomplishments is the recruitment of Dr. Louie, who's a breast melanoma surgeon, the recruitment of Casey Howell, an excellent nurse practitioner. Dr. Baer was named Interim Associate Director for Clinical Research for the Massey Cancer Center. Dr. McGuire was named the Medical Director, Associate Medical Director of the service line. And then also another great accomplishment is the completed breast health suite renovation at Stony Point. And just to give you an example of where we're beginning and how this all is encompassed from our patients from bench to bed to bedside and bedside back. You know, Dr. Fan is leading an incredible program with the tumor infiltrating lymphocytes. So just imagine we resect a patient's tumor. We're able to personalize the approach by isolating the TILs from these tumors or these lymphocytes, and then we can culture them, really invigorate them to attack the tumor, and then bring them back into the patient. It's kind of one beautiful circle of what we hope to do in this division, alongside with not only our mission under Dr. Kazarajan, as well as the Massey Cancer Center. So thank you very much, and I'd like to open up for the Division of Transplant, Dr. Marion Levy.
Good morning, everyone. Can I have the first slide, please? There we go. So in transplantation, we continued some very strong growth. Our core programs are adult and pediatric deceased deceased and living donor kidney transplant. We have an adult pancreas transplant program. We have a very robust liver transplant program, both deceased donor and live donor, which we'll talk a little bit more about. And then, of course, our total pancreatectomy with islet auto transplant. We're the largest transplant program in Virginia, and a really, I think, a rising force, if you will, at least numerically and by quality, actually, in the Mid-Atlantic and on the East Coast. And we're now a top 20 program by volume across the United States. As you can see, our growth has really been driven over the last 3 or 4 years, initially with kidneys and now robustly with livers and also hearts. Our projected solid organ transplant volumes is 453 organs for fiscal year 2020. Our surgical volumes are increasing. Our outpatient visits are increasing slowly but steadily. Next slide, please, Katie. I want to highlight a couple of programs. On the left is our live donor liver transplant. Vinay Kumran joined us about 18 months ago and has really brought tremendous skill and thought to the program. Under his leadership, we realized a ABO incompatible live donor liver transplant a few months ago, which has done extremely well. Chandra Bhatti, illustrating the slide on the right, has really been a pioneer in a robotic kidney transplant, implantation of kidneys, as well as robotic nephrectomy for live donors. I don't know if we can play the video just a little, once again, that loop, Katie, please. Our strategic priorities for the coming few years are to implement a lung transplant program. We're hoping to receive final permission from the state next week, actually, to enhance our pediatric liver transplant program under Dr. David Bruno's excellent liver leadership. Our services have gotten so large now that we're actually splitting into 2 transplant services, a kidney-based service and a liver-based service in January. And then we're launching efforts to understand if our brand is still current or if it needs to be enhanced. So I will stop at this point and then pass it along then to urology.